This is your source for local news in the Heartland. This is KTVO's Good Morning Heartland.
Welcome back. It is 6:23. September is National Sickle Cell Awareness Month. Sickle cell anemia is a disease that affects around 70,000 people in the U.S., most of them of African American descent. Sickle cell disease causes red blood cells to form in an abnormal crescent shape, and one of the most common treatments for sickle cell disease is regular blood transfusions, which can help reduce the risk of stroke, damage to major organs that can lead to severe infections and other complications. This morning we are joined by Dan Fox of the American Red Cross to talk more about the importance of donating blood. How are you doing?
Pretty good, thank you.
Great, and thanks so much for coming. You came all the way from Columbia this morning.
That's right. It was a fun drive up here this morning, as you can imagine, but I'm happy to be here.
Great. All right, so the first question is, who can donate blood?
Well, only about 38% of the American public can donate blood. Just very quick, some eligibility guidelines. You have to be at least 17 years old in order to donate blood. You can be 16 here in Missouri and in Iowa as well, as long as you have parental consent. You also have to weigh at least 110 pounds and just be in overall good health.
All right, and who needs blood transfusion? What are the type of patients that need blood transfusions?
Well, I don't want to say that everybody needs blood transfusions, because obviously that's not the case. But when you look at the number of people who do, it's quite a large number. We're talking about people who suffer from sickle cell. We're talking about cancer patients, sometimes car accident victims, people going into surgery, women giving birth can sometimes need blood. A lot of patients need blood. In fact, some numbers state that 1 out of every 10 hospital patients will need a blood transfusion.
And for those that have never donated blood because they're scared of the needle, kind of maybe just describe the experience. Like, how long does it take? You know, what's the experience like when they do actually go to a blood drive?
Sure. When you visit a Red Cross blood drive, the entire experience from the moment you walk in to the moment you leave typically takes about an hour.
Okay.
But only about 10 to 12 minutes of that will be the actual fun part. That is the needle in the vein and the collecting of the blood. It's a very tiny little pinprick in your arm. Most people don't feel it at all. Some experience only a slight discomfort. But when you think about what you're doing, you're helping save lives, that slight discomfort is worth it.
And do you know how many units of blood we collect in our region?
In the Missouri-Illinois region, we have to collect about 800 units of blood every single day to keep up with demand from our hospitals. So you can understand why blood drives all over the region, including here in the KTVO viewing area, are so important.
Okay. Now, do natural disasters have any effect on blood donations?
Certainly they can. Obviously, sometimes natural disasters, knock on wood that this doesn't happen often, but sometimes they can result in injuries. But what some people don't realize is that sometimes those natural disasters, while they may not result in injuries, they may end up canceling some blood drives because of roads being closed or what have you. And when you cancel those blood drives, you're obviously missing out on those units of blood you were expecting to receive.
Right. And when a person donates blood, how many units is that?
That is 1 pint of blood. The human body contains about 10 to 12 pints. When you donate, you're losing 1.
Okay, and how often can you donate?
And because of that, because you are losing 1 pint of blood, you obviously need your body to recuperate a bit. And so it's about 56 days, or roughly 2 months, between donations.
Okay, and we have several blood drives coming up, including one today at at Dare County R1 High School in Nobbinger, and it's from 1 to 6 p.m. So if people are interested in donating today or any of the other ones, which we'll post on our website, what do they need to bring?
Remember to bring a photo ID with you, and also remember to get something to eat before you come. You're not going into surgery. You don't need to fast here. In fact, we actually do ask people to eat and drink some water before they come to donate, because, again, you are going to be losing 1 pint of blood. And so to offset any feelings of wooziness or uneasiness when you get off the bed, we ask that you have a full stomach.
And then afterwards, you do have some light snacks and drinks to kind of recuperate them, and so they don't feel woozy or dizzy after they leave.
Right, that's exactly right. And some people don't feel any side effects at all when they leave, but we always offer free refreshments afterwards.
All right, well, thank you so much for your time. I greatly appreciate it.
Thank you for having me.
And we'll post everything on our website at heartlandconnection.com, and now we're just going to...